I'm here with Dr. Kent Meredith, Intermountain Medical Center Heart Institute. Thank you so much for being here. It is Heart Awareness Month, the month of February, so I don't think we can talk too much about how to be prepared and know the signs.
That's right. You can never be too prepared for a heart attack.
And especially it being the #1 killer for men and women. Talk about some of the signs, and there are also different types of heart attacks.
Yeah, that's correct. So first of all, the signs of a heart attack, the most common thing we see are some type of discomfort or pain in the chest, the jaw, the neck, the shoulders, maybe even in the upper part of the abdomen. Shortness of breath usually goes along with that, and sometimes patients can feel nauseated, they can vomit, sometimes feel lightheaded, even pass out. But any patient needs to be aware that not every heart attack will have those types of symptoms.
You often hear the description of it feels like an elephant is standing on your chest.
That would be the typical, but not every heart attack reads the textbook.
So let's talk about these different types of heart attacks. We talked about the widowmaker, which is very, very severe.
Right. So when someone suspects that they may be having a heart attack, what they really need to do immediately is get to an emergency room. And the reason is the most important test you can get is an EKG. It's one of the cheapest, low-tech types of medical tests that are available. It's been around for over 100 years, and yet it's still crucial. It's the most critical thing that you need to have done within minutes of suspecting that you're having a heart attack. So get the EKG, and the EKG helps us determine whether it's a STEMI heart attack or a non-STEMI heart attack.
What does that mean?
Well, we describe the pattern that we see on the EKG. We don't really need to get into that, but it helps us decide if this is the type of heart attack that needs to immediately be taken to the heart cath lab where we open up a blocked artery, or if it's the kind where we can use medications to help stabilize the patient, help things kind of settle down a little bit, and then later on we worry about what to do as far as the blocked artery.
Who would be a good candidate for someone requesting an EKG? I mean, what are some of the smaller signs instead of, obviously if you have a heart attack, it's a little too late?
Well, one of the great things about an EKG is it's so inexpensive that we use it a lot in the emergency room when anyone comes in with even symptoms that might even possibly be associated with a heart attack. They may not, it may be something that it's not straightforward, but it's so inexpensive and it's such a good test to immediately rule that out that we would do that. So anybody who's having, even nausea, vomiting, sore throat, we say anything between the nose and the navel is worthy of checking an EKG, because that's the extent, that's the range where you can have symptoms of a heart attack.
And shortness of breath is also a telltale sign.
Always, yeah, that would be in that list of possibilities for a heart attack.
Okay, with more information, where can we find you?
Well, you can always go to the Intermountain Heart Institute website. There are lots of things you can find online about symptoms of a heart attack, or you can ask your doctor.
All right, excellent. Thank you so much. And of course, we'll have all that information on our website at goodforutah.com.